Science education, fitness too. Molecular Mom's got it all for you.
Hi, everyone. Thanks for joining us today on this episode of Molecular Mom. Today, I have the pleasure of having our first male interview, Mark Adams, who is the health commissioner of Henry County in Ohio. I'm actually from Ohio originally. Mark Adams was someone who I dearly loved as a child. He was like a brother to me. And I haven't had a chance to really speak with him in person for a long time. So I just wanted to thank him for agreeing to do an interview. And today we're going to talk a little bit about vaccines, which is a big issue that I want Molecular Mom to be an advocate for. So you want to just do a little intro
Sure.
for yourself?
Well, I'm Mark Adams, the Henry County Health Commissioner, and I've known Molecular Mom for about 30 years, and it's been a long time. Public health's role, we have a role in vaccines and the promotion of vaccines, and so that's just one of the aspects the health department does. Usually in just about every state, you'll probably get your birth and death record from a health department. You'll have an environmental health department that deals with sewage or animal bites, or you'll have maybe a Help Me Grow or a WIC, Women, Infant, Children program, or some sort of sexual health program as well in public health nursing. But one of the major aspects of a health department and a public health department is the prevention or spread of disease. So you may have seen in public health, we have this promote, prevent, and protect. That is our mantra, whether we have our own maybe mission or vision statement, but that has always been the role of public health for a couple hundred years. And as science changes, disease change, we have to adapt with that. And so I wanted to, and I appreciate being invited on, so that way we can just talk about the some of the myths out there. We're not in, we're tying up flu season now, but the vaccines will be coming out again in late summer. So just to get some information out there about flu vaccine when it comes out, and then probably touch on what's happening with measles. I know that's making the news. It was, and now it's kind of quieted down a little bit. So it made, it was that end of April, month of May, it was a hot topic. Now that we're in June, school is out, and we kind of put that to the side, and we're looking at other things now. But just like public health is to bring back that stuff and talk about it and get an understanding. So,
right. Yeah, vaccines are. It's really kind of confusing to me how there's so much pushback right now, and there's just a lot of myths surrounding it. Between autism, these
right
papers that have been published and have been refuted, and these papers have been pulled back, and it's been shown that the links to autism are not legitimate.
Right.
And things like, the mercury in vaccines and things like that people just don't understand the science and the nuance behind all these things that, and I think that they're out of touch with the severity of these diseases as well. I mean, any sort of medication that you take, there's always a trade-off, right? That you can have side effects. And so do you want polio, or do you want to have, I might have some mild symptoms of some allergic reaction to a vaccine?
Sure. And that's why I keep this behind me at all times, so that everybody in public health, when they walk in my office, they see a ward in the 40s with everybody in an iron lung. Mm-hmm. And it wasn't that polio it just died out on its own. It died out because of a vaccine. And what happens is public health actually gets really good at what it does. And essentially, it's not that it eliminates disease, because it's very difficult for us to completely eliminate it, but it gets so good that we forget what the actual benefit was. So whenever there has been a push, historically, hundreds of years, whenever there's been a push to prevent something, there's always been the other side that has said, no, that's not going to work, because their basis is, I'm not comfortable with what you're showing me. I mean, we know what has happened through people that have tried to prove science for years, and they're outcasts, they're debunked. They're in any way somebody is trying to say what they're doing or what they're saying is just not for me, and then this is my belief why. So I've got some great political cartoons from 1850s, 60s, when they were developing smallpox preventative techniques, and they mirror almost the same arguments that exist today when it comes to the MMR vaccine. And a lot of people have no idea, so they think, okay, well, I haven't heard of a measles or mumps. Well, mumps, very few deaths ever, really, but they haven't heard of a measles death. Well, there are actually still quite a lot of people that die of measles and even with the vaccine, if you want to do natural immunity, so natural immunity is when somebody says, I'm going to subject my child to somebody that has the disease. You actually have a 1 in 500 chance of having a fatality due to the symptoms of catching measles that way, as you a 1 in over 1 million chance to getting it from anything that might occur from an adverse reaction from a vaccine. So the science has proved that. The data is there that proves that. And Andrew Wakefield's paper submission in The Lancet in 1997 is what the basis of, and unfortunately what happened was the internet. So for all of us that are going to be 50
Google
experts. Yeah. For those of us that are going to be 50 this year and got involved in public health before the internet was around, we really had to read everything, and then we had to mail it to someone to get information out and actually do outreach. Public health failed at a period of time. We got used to the internet. We started using it as well, and we stopped doing community outreach. And we started to rely on social media and just media itself, electronic media, to get information. That's where we failed in the late 90s and through 2000s. That's how Andrew Wakefield's message got to get so far as it did. Because people won't, if there is no other leader, chaos will ensue. And where public health stopped putting a face to, hey, I'm actually here to help. I'm here to provide a vaccine. Look at my face.
Right, yeah.
See, my face is here to help you.
Big pharma.
I'm not big pharma.
I'm not the boogeyman out to get you and try to rip you off.
Right, you're never going to get rich. Yeah, absolutely. And because my face wasn't there, or the faces of the public health nurses wasn't there to be able to say, trust us, people will find trust in something else, whatever makes them feel comfortable, which is why when somebody is, I even have people on staff that, at least one person that is not vaccinating their children. I do not look at them and say, I'm going to cast you out of this. I understand why they're in that position. So my objective in public health is to regain that trust. And if that achievement is to be able to get that person to vaccinate their children, then that's an achievement. That's how we should have never stopped doing that 15, 20 years ago. And so even though that report, and as you first mentioned, in that report, that sparked then a lot of other, because with every scientific experiment, it has to be reproducible. So they went through and tried to redo it again, or tried to find any way. So we have a suspicion out there that was raised, even though it was debunked. They cannot reproduce it. There is no other study has ever been done to show a link between autism and a vaccine. And more studies are coming out showing that the autism spectrum started to show prior to receiving the first vaccine. And there are some studies that are now starting to suggest that spectrum started to show itself in the womb. So they're going even further back than that. And when it comes to flu vaccine, you ever heard that thing where somebody says, I got the flu vaccine, and 2 days later I got the flu?
That's my husband. He actually does get the man flu symptoms, and then
yes.
they just, he gets a low grade fever, and he gets like sweats, and it's just, and so he gets like this immune reaction, but it's very short. It's clearly not the flu because it's over within 24 hours.
Yes.
And so he hates getting the flu vaccine, but I make him get it whenever I.
That's right.
So we're gonna have a baby around. You're gonna go and get a tetanus update. You're gonna go get, you're gonna get all of your updates just to make sure that your bases are covered, because you're not giving an infant the flu.
Right. Well, and death from the vaccine is so negligible. In a 5-year period, they only had one death attributed to the vaccine. Where? In just the U.S. alone, we still lose 36,000 people a year to flu. Now, is the vaccine perfect? No. They try as hard as they can to get the strains that are most common. We watch what is happening out in Asia. We say, okay, this is what's spreading first because of the type of environment they live in. We see how it spreads. We start to, but by the time it gets to us, it sometimes undergoes a genetic mutation. And while we wish we could predict that, public health just really can't predict that. It's just not perfect, but it's better than if we did nothing at all. And I also used to have a picture of what Spanish influenza and people walking around in 1918 looked like. 54 million people from a communicable disease. I tell in all the classes that I have, wherever I'm teaching, you could add up every war we've had throughout time. And even if you looked at World War II, it's suspected that in World War II, even with civilian deaths, anywhere up near 50 million people, and 20 million alone in China, but up to 50 million people, civilian and military, perished. Some numbers are showing it around 72 million, but still, just in that's 6 years, 8 years of war. In just 1 year of Spanish influenza, 52 million people. So that's just that one. But if you take every war, add it all together, it will never, I mean, every year we lose 600,000 people to mosquito-borne diseases across the world. And people will say, no, but that happens over there. Well, we said that with Zika, and we said, no, it's down there at the Olympics, it's not going to come up here. And then all of a sudden, we started spraying in South Carolina because we found it in Miami and started spraying in Miami.
Just our first case of West Isle last month in spring, where I live.
Yeah, so 99, 98 is when we figure it came in, and 99 public health started to really ramp up its efforts and deal with that. So in one aspect, and what I had started saying was when public health gets to be so good at it, we forget the importance of public health. And then we start saying, I don't understand that data, but I can really understand a child that's on Facebook that a parent has posted supposedly a picture of this child before the vaccine and after a vaccine, and then it goes viral. But yet we have no verification at all that that's even a child that's been affected by a vaccine or any type of some other illness. And the people will exploit that information, then keep forwarding it on, and then it becomes gospel to them. And I almost then have no chance at making a connection with them, saying, listen, I'm not making any money from your vaccine. I just want to prevent the disease. So, and what I hope this comes through, what I did is I wanted to describe herd immunity real quick. So, in just an explanation of herd immunity, in this one, these first graphics, we have nobody that is vaccinated and disease enters, and then everybody gets it. So we have close contact with everybody. Where we have some that are vaccinated, we still get everybody that gets it. We haven't reached that threshold of herd immunity. But here, if we have the majority of people vaccinated, not everybody, and because some people just aren't going to do it, they don't have the ability to make a connection, a personal connection with somebody, an unvaccinated person. Right, and an unvaccinated person won't be able to catch another unvaccinated person. They won't be able to see each other. The 6 degrees of separation exists. Right. And so then we stop the spread of disease that way. So if that helps anybody understand herd immunity, I hope that's it in a nutshell.
That's a super important concept for newborns because, like, I have a 6-month-old. He can't yet be vaccinated against measles, and I'm kind of scared to death to take him out in public or put him in care because he can't be vaccinated, and if he's exposed to children that aren't vaccinated or other people that aren't vaccinated, with the rates of measles going up, he could get it. But if you have high vaccination rates, you have this herd immunity, and it protects these infants that can't yet be vaccinated, or people who are immunocompromised, or that can't get a vaccine, or that the vaccine's not effective. Like, it protects those people that can't be vaccinated. So.
Absolutely. And in that way, it's protecting our choice to vaccinate. But there's that period where we can't vaccinate them yet because of their age, and we're trying to protect those children. So, it's not that they're evil. It's just I know nobody's suggesting that, but I see that on the internet. I see that where people are calling people that, and it does a disservice. It does a disservice when it's based. And it's based on false information. If somebody was to come to me and convince me, I'm going to go with data every single time. And if they were to show me data that it's going to cause them harm, done, you got it. You got my attention. And if you've ever watched a child whooping cough, if you've ever seen the lasting effects of polio, if you've ever seen a child and that's going through mumps or measles, or somebody that's in a hospital in the ICU with flu, when it was a preventable disease. You might look at that data and go, that's a reality. That can actually happen. Wow. What's odd is that if somebody were some folks, if they were bitten by an animal, that we've scared them with rabies. So automatically it's like, oh, I'm getting the shots. I'm going through this. It's a vaccine. That's a way that we're trying to prevent that disease because it's 99% fatal. There is that one person that lived. And it's just, if there's any way that public health can provide any service to anybody, one of the things we have to do is we have to learn to go back out in the field and make face-to-face contact. So we have, I went from a department that had 0 health educators to one that now has 4. And the nice part about that is that's exactly what we're doing. I mean, it's a very rural farming community, and we're making sure that we are making a personal connection. That was one of the things that we changed when I got here was I said, oh, not only is everybody kind of a health educator, but we are going to have dedicated people doing it because I'm going to have an entire staff of people to work on the people that are sick when I can have with a few staff members talking about disease prevention. And that's the move, the shift that public health really needs to do is the health education and outreach to prevent and to bring that face back that says, look, you trust me, I swear, look at a smile. I'm not here to hurt you, I promise. Right. So that's, and it's a rewarding career. Nobody gets rich off of it. Since we're not tied to pharma, if somebody thinks that, we're not. And, nobody gets rich, but the part that's rich about it is you get to see people when you're looking at them through the WIC clinic, maybe when they're 6 months old, and you get to see them coming and getting a shot, 18, or a travel clinic when they're 25 and they're going to Europe. And you got to follow that. They lived because of that and because of those prevention techniques. So,
that's great. No, I mean, I really think that's a great initiative. And it's one of the things that Molecular Mom is sort of trying to push.
Yes.
Science education, putting a face on science, a relatable face on science, and because people they sort of get out of touch and they just think of big corporations and they're kind of guided by fear right now. So I really encourage you to keep doing what you're doing and the outreach and putting a friendly face that on facts and science and public health.
Well, I appreciate it. Thank you for that.
All right. Well, thank you for joining us
on
this episode of Molecular Mom. Tune in for our next episode.
Well, I've got to do this. Thank you, Doctor. I just had to say that.
Yeah, you have it.
I love that. I love that so much. I'm so proud of you. I can't tell you how proud I am of you. So that's great.
Thank you.
All right.
Science education, fitness too. Molecular Mom's got it all for you.